DJ Leroy.
Night Watchman, how you doing, buddy?
I'm well, trying to stay cool.
Oh, is that it? You think it's kind of hot out there, huh?
It's not where I am. I'm in air conditioned comfort.
See,
I might not leave here for the rest of the month.
Oh, wow. Yes. See how that goes over with your wife. Okay, fine.
She can come. She can come visit me.
So, Night Watchman, as you know, that me and the missus, we were in the mountains. Can you say the Poconos?
Mm-hmm. Was it cool?
Lake Harmony, and of course Boulder Lake. Definitely, you should put it on your bucket list, man. Definitely. And Night Watchman, I thought you were going to be checking in on me every now and then about my health, because you saw we just lost Malcolm Jamal Warner. Of course, it was a drowning, but still, man, you got to check in on me.
I do check in on you. I just don't check in you directly. You know, I can check in with your son, your wife. Is he exercising? Is he riding his bike? You know, and some of the reports I get back are not good.
So is that why this particular show we're just going to look at health? Is that it?
That's right. Health is a good thing, you know.
It really is. Well, you know what? We definitely should then have a veteran of these discussions on Soul Lounge Prime Time, Miss Deborah Levine. Yes. How you doing, Deborah?
Hi. How's everybody? Back. Thank you.
Yes. We're good, but you know what? I'm feeling it already. It's starting to feel a little hot here, Deborah. And I heard that someone says that there is no global warming, but do you believe that?
No. I think,
okay.
Just looking at the weather and seeing what's going on across the country, no. We see floods and all of this unfortunate stuff that's sort of going on. So, yeah, it's definitely, and it's going to be a scorcher definitely this weekend.
Gotcha. Wow. All right. Night Watchman, stay under that air conditioning. Well, you know what? We also have two newbies to Soul Lounge Prime Time. First of all, I want to bring up Miss Carolyn Olson. Kari. Hey.
Hello.
How you doing?
Thank you for having me. Such a privilege.
Absolutely. Well, I thank you, because literally you came to my attention when I was looking at some of the heat advisories that the New York City Department of Health was issuing. So thank you for that.
Oh, well, I want to say it's the National Weather Service who keeps us knowing about the forecast. And it's true, we're having a heat advisory today. So everybody needs to be keeping really cool and staying safe because it is going to get up to 105.
Wow. Oh, thank you for that. Oh. Anyway, Night Watchman, not to be outdone, because last time I checked, I am indeed a Black man in these United States, and I have some of those health indices or ailments that like high blood pressure and the like. But you say you don't suffer from something like that. Is that correct,
That's
Night
correct.
Watchman? Diet or your daily walks? What's going on?
I'd say it's a combination of both.
Very good. Well, you know what? I want to hear from one of the sources. Black Health Matters. It's Roslyn Young Daniels. Yes.
Hello, everyone.
How you doing?
I'm great. Happy day to you all.
Beautiful. Well, Night Watchman, being that you are also one of these people who has led the stuff in the past, would you like to kick off any questions?
Well, I want to hear from each of you and just talk about what you think the leading issues that we need to look at in terms of health in our communities today.
Let's start up with Deborah. Do tell. And Harlem Health Initiative. Yes.
University Graduate School of Public Health and Health Policy in the village of Harlem. So as always, it's a pleasure. Health in our community. Health literacy is super important. Being able to help people make informed decisions. That's why working with organizations like Black Health, the Department of Health, being able to keep information that's current and being able to get it into the communities is so critical. So kudos to everybody here, and thank you for all the good work. But we know we have a long battle and a hard battle to ensure that our communities stay educated and have access to care.
Beautiful. Thank you for that, Deborah. Carolyn, you have to tell us, in terms of the health advisories that you guys, or heat advisories that you guys issue, Department of Health, there were some other things that you guys were doing, of course, during the pandemic. So please tell me some of the measures that the New York City Department of Health and Mental Hygiene do to advise the public.
Sure. Yeah. Thank you so much. I think that, as we're thinking about the health of New Yorkers, we're always thinking about the ways in which we can get that information out there. I really appreciate Deborah highlighting how important it is that we all work together. During the pandemic, actually, particularly in that first summer, remember, we were all under that New York State pause and we had to stay home. And one of the things that we had to grapple with in that time was the fact that the way to stay safe from transmission was to stay home, stay safe, try to reduce the amount that we go out and are with others, but also climate change means that our summers are getting hotter and hotter, and that heat is dangerous. And so one of the things that the city did, the health department in collaboration with and led by the New York City Department of Emergency Management, we gave away air conditioners to older New Yorkers, because we knew that for some people who don't have residential cooling, they're at greatest risk of heat-related illness and even death. And we wanted to make sure that people could stay safe in the pandemic and stay cool in their homes and not be in a dangerous space. And so we gave away almost 72,000 air conditioners, installed them in the homes of older New Yorkers who did not have an air conditioner and were low income.
Wow, wow. No, excellent. NightWatchman, you have your air conditioner at home or no, or only at your office space?
No, I have air conditioning at home too.
Yeah. Very good. Well,
I'm not trying to be a victim of heat exhaustion or heat stroke.
Very good. Well, Roslyn, please, Black Health Matters, because you've heard of some of my maladies that I suffer from high blood pressure and also high cholesterol. So do tell, what are you doing to address these maladies in our community?
So, I heard you pose a question to your colleague about, well, how are you doing it? I understand that you may not be treating these conditions. And, heredity has something to do with it, too. Sometimes we just get dealt a great set of genes, and they are more strong and can help in certain situations. So that's also something that we need to all be aware of, is what is our family health history? Because that, too, can help guide us so that we can be healthier today and tomorrow. But going back to your question in terms of what Black Health Matters sees are issues for Harlemites and all Americans are the cuts to Medicaid, Medicare, and the fact that we're expecting that millions are going to lose health insurance. According to our statistics, 12,000 people in Harlem alone will lose health insurance. So we're also looking at people losing their subsidy based on the Affordable Care Act. So quite frankly, unless we become mobilized around identifying and being more specific and intentional about preventing disease, managing disease, we may not have the outcomes that we want.
Thank you for that. And Roslyn, so interesting, especially I believe when Obama, slightly after he had left, and they heard this backlash in terms of, let's say, the Affordable Care Act. Oh, no, I want my health insurance. I want it. But it's Obamacare. And suddenly there was that serious backlash. Do you still see that happening? Or are we educating the public adequately regarding health?
I mean, I think healthcare is a divisive, it's a highly politicized issue, and we need it. The outcomes of the United States in terms of health are really poor. Even though we are a world-class power, we are a global power, and our health outcomes are some of the worst of all industrialized nations. So what does that say? Is there really intention for American citizens to be well? And as you and I know, race plays an important part of it. I hear people all the time say, well, do people of color really want to be healthy? And if so, they can just snap their fingers and it could happen. So there isn't any empathy towards our plight, which is why I launched Black Health Matters, so that we would have a rally cry and something to mobilize around. And on our platform, we provide access to screenings, access to healthcare professionals, information, because knowledge is power.
Excellent. Well said. And Deborah, especially in our community, I'm thinking about a particular project in our community. It was a simple real estate project, okay, a little bit further north from where we are, right? And because the particular developer did not necessarily get what they were first seeking, they were going to do what they could do, and that was actually have a truck depot. Okay. Now, in one of the communities that has one of the highest asthma rates, have you seen some of these particular projects always come to our communities?
So I think you can share that example on a few different levels. And yes, I think we're still continuing to see that sort of behavior from developers. And I wouldn't want to categorize and say all, but there are these instances where this is occurring in the community. But being able to have things like our community boards who are really working with both the Department of Health, Black Health Matters, other organizations, FQHCs, are like our school, are really galvanizing together to really bring the data and help community make informed decisions. And I think those kinds of partnerships really help address some of those issues that we're seeing, not only just in the village of Harlem, but all across New York City and the state.
Gotcha. And Carrie, I definitely, I'm here in Harlem, right? So I know about our issues, but let's say circumnavigating the city, what other areas are of concern to the New York City Department of Health?
I mean, it depends. We're invested in protecting all New Yorkers and all communities, of course. And my focus and my expertise is on environmental health. And so one of the things that we do is think about how environmental factors intersect and really are what, the places that we live, where we work, where we play, this really influences our health. And so I'm going to stick with heat because it's so hot outside today. And I'm going to say that one of the things that we do is we look, we have something called a heat vulnerability index, where we look across New York City neighborhoods and try to understand what are the factors that make different communities more vulnerable to heat illness. And so that includes both environmental factors, like how much green space there is, as well as social factors, because of all the things that were just being discussed, including poverty and race, because we know that social inequities and structural racism have influenced the ability for people to stay healthy and to and have actually resulted in disproportionate burden of chronic diseases. And so even more than that, it has influenced the access to air conditioning. And so, as I was mentioning, the number one risk factor is not having air conditioning in your home. And I can tell you that, for example, in Harlem is one of the highest heat vulnerability indices in the city. Wow. And so overall in New York City, over 90% of people are living with an air conditioner at home. But in Harlem, it's all the way down to 85% have an air conditioner. And that's just the equipment, because we also know it costs money to turn them on, right? And,
yes, correct.
And that's a real burden for many people. And so we're also looking across the city to understand energy insecurity. So the inability to meet household energy needs. And almost 3 in 10 New Yorkers are struggling with that across the city. So we're really trying to think about how all of these ways in which we lead our lives and the environment that we're living in, how does that influence health, and how could we hopefully influence those factors to help improve health for across the board for everyone.
Beautiful. So staying on, let's say, environmental. Okay, I was contacted, I guess a few years ago by Weill Cornell Medical Center, specifically their Cool Trees program. So, Carrie, please tell me the importance of trees. Why?
Yeah, trees are really important, and the city is actually embarking on its first urban forest plan, which is focused not only on the number of trees, but actually the canopy of those trees, right? So how much shade can they cast, and how much can they help alleviate that urban heat island effect? But also trees and green space are important for our mental health, right? It's important that we have beautiful spaces to be in. We have places, you were talking about going for your walk or your run. People are more likely to do that type of physical activity when they have a green space in which to do it, whether it's a green way, so sort of making our streets greener and cooler because of the shade, or if it's one of the many parks that we have. And so there really is an investment in trying to increase the amount of trees in our neighborhoods. And I'll put out a plug that you can't just plant a tree. You have to take care of that tree, and that's really a challenge. And so I know that the Parks Department is constantly working with many partners to think about how can we be maintaining and really providing stewardship for the trees that really make our city so much more beautiful, cooler, and healthier.
Excellent. Roslyn, so you heard about some of my health concerns in terms of having losing a sister to endometrial, a father to also have a brain, and then of course metastasizing to the bones and so forth. So what is Black Health Matters doing in terms of, let's say, encouraging, especially guys, because unless we're bleeding out, we don't go to the doctor. So what are you telling them to do?
So we actually have a very special place in our heart for the brothers, and everyone jokes around. But I have a testimonial, right? So about 8 years ago, I became single, and so here I am, good looking, vivacious, fun, upwardly mobile. I'm looking for a comparable dude, right? I want to exercise, I want to travel. So the guys I'm looking at, they can't exercise.
What?
I want to travel. They have to take too much medication. Got to take machines. And the burden of whatever it is, the cost of healthcare, right? So they ain't have any money. Can't go out. Can't do this. Can't date. So I was like, boy, this is a very sad lot I'm coming across these days. But when I peel back the layers, I have to understand that there's something, as Carrie said, called the social determinants of health. And there are other structural situations in place that really make it hard for Black men to be well in this society. We're hopeful that when you do interact with physicians, that they are listening and that they show respect, because that's so incredibly important. People are vulnerable when they go into that hospital room or when they go into that doctor's office. And if for some reason you're not treated the way that you need to be or should be, it's definitely something that you want to avoid. And so we've got to make healthcare more engaging, which is why our website, Black Health Matters, has a channel just on Black men's health, whether it be mental health, whether it
Wow.
be fitness, nutrition, and various cancers. So we know that the health of Black males in this country actually falls to some of the lowest in terms of survivorship of cancers, heart disease, all of those conditions. So we really need to treat the Black men in our lives with honor, dignity, and make sure that they take care of themselves.
Excellent. Thank you for that. Now, Watchman, you know I rib you sometimes, but I definitely want to say that when you were actually doing the care for your moms and pops, that you also became educated to a lot of things that you did not know about. Would you like to share some of the things that you learned during that particular journey with them?
Well, yeah, and that's another issue that I think we all face. A lot of people face the issue of not only their own health but of aging parents, and people get caught in the middle. They get to a point where they're worrying about their kids, and then all of a sudden they have to worry about their parents' health as well as their own. So there is something about the generational issues we have to deal with. So some of those issues involved with my dad, it was, he had Alzheimer's. That's something that's run in my family. My grandmother had it. And so, you start to look at some of the causes of that and trying to address those things early on. And, I certainly started looking at, some of the nutritional issues. And, I've tried to do be very strict in terms of how I eat and some of the things that I stay away from, because the data is there that a lot of things nutritionally exacerbate these issues. And so processed sugars, processed food, things that create inflammation in the body, there's connections to all of the leading, whether it be diabetes, whether it be Alzheimer's, whether it be heart disease. A lot of these issues are very profoundly affected by what we eat, as well as exercise and sleep. So there are a number of things that we have to address from a lifestyle standpoint in order to have the health outcomes that we want to have, not only for ourselves, but for either the generation ahead of us or the generation behind us.
Thank you for that, Night Watchman. So one of the things, so Deborah, one thing, so you're going to be participating, I know, in the Harlem Week, the Health Summit and Expo. But when that's not happening with Harlem Health Initiative, what are you doing to get the word out, your mission and its impact on the community? What are you guys doing there?
So thank you for that. Our goal, as you know, our dean, Dr. Ayman El-Mohandes, is really a believer that our school and academic institutions should really be part of the fiber in a community, not just an academic institution in a community. So the Harlem Health Initiative is the school's community engagement arm. We work very closely with community boards, with block associations. I'm a member of the Harlem Hospital CAB, where I work with other board members to make sure that we're getting health information out and working with the hospital to talk about the good work that they do. But we do everything from work with organizations to build health literacy in their staff so that they can then share that information with the constituents that they serve, to working with our students to make sure that they're community centered in the work that they do, to being able to also work with our elected officials around health policies. So you'll see us show up in places like Harlem Week, working with our partners to talk about Harlem Strong, which is a mental health initiative where we work with several community-based organizations training community health workers on anxiety and depression. to our cannabis equity work, where we're talking about the use and understanding of medical cannabis and the new legislation in terms of recreation and the impact to communities. So we show up where community allows us to show up, and share our expertise and really help build a sense of collaboration. And so for us, we're super excited. Quick plug, next week, we're doing a menstrual equity summit for young people between the ages of 13 to 18 with Team Pact, who young people built out all the webinars, all the workshops, and the full day. So things like that is where the school really belongs, is being able to be a safe place to talk about some of those hard issues around social and racial inequities that we call social determinants of health.
Thank you for that. And Carrie, so I know your particular lane, of course, environmental. So now the city has not always been in that particular lane. So prior to that, well, when things that would affect residents as a result of, let's say, the environment, what would the New York City Department of Health say what was happening?
Well, so there's a variety of ways that we're trying to work with communities, and I really want to build on what Deborah was talking about, just how important the social infrastructure of neighborhoods is, and the connections between whether it's the schools, the universities, the organizations that are really the fabric of the community. And so one of the things that we've really been focusing on, there's many things the health department does, I can't talk about all of them, but really trying to think about how we can be in communities and working with the organizations that know the people there the best. We know that government is not always the best messenger. And so we really want to partner with the people who are trusted in communities. I have to shout out the Harlem Action Center. I know that Padmore has been a guest here, and there's an amazing organization that's based in Harlem that does incredible work, a lot of focus on asthma and working with community members, not just on clinical treatment of asthma, but also thinking about those environmental aspects in the home. So for example, living with pests can actually exacerbate your asthma, make it worse. And so we have programs through Harlem and other parts of the health department to, if there's a child or an adult who's living in a home with asthma, if their doctor says, reports to the health department that they have pests, then we will come and investigate and then issue an order to the landlord saying that has to be addressed. So that's like one example of a direct sort of intervention where we're trying to make the environment better for folks. And then going
further on that. So let's say you've had experienced a leak above your in your apartment for a number of years, and now you enter the apartment and there's a smell like mold. Do you send in folks to investigate something like that?
Yeah, mold is also something that you should report to 311, and our colleagues at HPD, Housing Preservation and Development. I mean, folks don't need to know all these different agencies. What's important is that the government is there for you, and they will send out somebody to investigate. And it's definitely, mold is also can make, for example, asthma and other respiratory conditions worse. So we want to make sure to be addressing those things. And I also want to mention, I think it's important to think about folks who are working outside as well, right? And sort of our homes are incredibly important. But again, in the heat, and we're talking about having health conditions, which can be worsened by the heat. And one of the things that we're working on right now is a pilot with the mayor's office and emergency management and the Department of Transportation, as well as some amazing community partners to do pop-up cooling stations. So these have tents and misting and then resources for people. And we're really trying to reach out to outdoor workers, whether it's deliveristas or day laborers, so that they have a space that is a little bit cooler where they can stop and take a break, but also get information about how to stay safe. Because I think this is another, we a lot of times in government are thinking about big policies, but really the work happens on the ground in communities by all of these amazing organizations. And so we're always interested in finding new ways to partner with folks.
Carrie, I'm really loving that. That's kind of cool. A night watchman. Now you can actually leave the office and go to a cooling tent.
Absolutely. I want to shout out another great organization that works on this stuff, and that is We Act.
Yes.
For environmental justice. Many people consider them the leading environmental justice organization, not just in the city or in the state, but in the country. And they initially were started as a result of the sewage treatment plant that sits beneath Riverbank State Park, and they've had such an interesting impact on things, everything from the hybrid buses that we have. And so they have an annual barbecue, which happened last week. I think you were still in the Poconos, Curtis, which is probably why you were not there. But, all the elected officials make the pilgrimage there because it's an important one. Peggy Shepard, who's been a guest on our show, has done a great job. One of the things I appreciated about this barbecue was that they addressed it. It was very hot last Saturday, and they addressed it. And they had somebody come up and not only talk about how hot it was, but they had one of their staff give an explanation of heat exhaustion versus heat stroke and how to recognize the differences between them. And they've also worked on a climate uptown plan. They've worked with a number of organizations in Harlem, including Harlem Emergency Network and the East Harlem COAD, which is Communities Active in Disasters. And so a lot of the issues that we talked about before, the greening space, they talk about those issues, and certainly the cooling centers. And as Carrie mentioned, it's the collaboration between our government agencies and the organizations that can make such a difference in terms of awareness and in terms of people changing their behavior accordingly to adjust to the new reality, because it doesn't look like it's going to get any cooler in our lifetime. So we have to make these adjustments, and we have to be aware of them and act accordingly.
Beautiful. Thank you for that, Night Watchman. And you know what, Roslyn? So I'm thinking, one of the things I underwent a study. It was a study with Weill Cornell, and it was high blood pressure and possible effects on Alzheimer's. So now, with Black Health Matters, do you guys talk about some of the innovations that are happening in the medical space and possible effects on communities of color?
Absolutely. So on our website, www.blackhealthmatters.com, in addition to men's health, we have a condition-specific channels that deliver information on more than 28 chronic conditions. So whether it be Alzheimer's, and what's interesting about Alzheimer's, because I know you mentioned it, when we surveyed our audience, Alzheimer's is one of the top concerns that they have. So that's interesting.
Wow.
So, and it was more so than cancer or heart disease. So that's something that's very much a part on top of mind for our audience. But yes, we talk about hypertension, we talk about nutrition, all types of information. And it's important. Science changes every day, and there are advances every day, and we do our best to stay on top. one thing I do want your listeners to understand, that when you're seeking information, make sure that it's based on medical science and that there is some rigor around these claims that are coming up. Because one year, one thing will work and the next year it doesn't. And it has to be frustrating for lay people. It's frustrating for all people. So make sure that if we call it evidence-based journalism, that there's some facts and it's quoting credible sources, and that it's reported from a perspective that is not based on, how a testimonial. You want more, again, academic or scientific rigor behind what you're going to follow, what you're going to read.
No false science. Absolutely.
No false science. And then let me just also say, Kurt, I know we were talking about the environment and the sun. As you can see, unfortunately, I have this weird cast going on. And that's because before I took my walk, I used sunblock because people of color often don't use products to protect their products to protect their skin. So it's important that we all realize that in these dog days of summer, make sure you walk out and you're wearing some sunblock that will protect you from the top of your head to the bottom of your feet.
Roslyn, I know fully well, because Lord knows I went to the Caribbean thinking that, and I'm a light complexion black dude, but I don't need no daggone sunblock. And Lord, burning is not a good thing.
It is not a good thing.
And eventually, I guess it does take a toll on your skin, huh?
Over time, it will. So, what do they say? Good black don't crack? Well, we are melanated people, but you will be able to make sure that black skin is glowing and healthy if you protect it in the summer or all year round with some level of SPF.
Gotcha. Oh man. So I guess one of the things I also heard earlier, and I want to give you some props, Deborah, because mental health, that's certainly something that we don't necessarily address in our community. More and more, it's been getting the traction. And I also want to give you props for the cohort in terms of young people or teens who are also in that space and talking to one another about that. Tell me more.
So let me just say that there's something wonderful around bringing young adults into a safe space, especially when they have an interest in becoming community health workers and being able to not only educate themselves, but sort of be that beacon and talk to their own peers. When Roslyn talked about having evidence-based information that's based on science, that's based on rigor. We're training and in partnership with Community Health Networks, Teen Pact, YCHAC, and a few other youth groups to work to help them expand their conversations about mental health and well-being, talking about sex and sexuality, some of those really hard conversations. But another component to that is also working with the providers and helping providers learn the language so that they are more comfortable in raising some of those issues and being able to be there for our young people when they show up in clinics and in spaces, so that they're youth friendly and also have the language and are comfortable talking about issues of growth and development. So that is where the school shows up. It also gives us an opportunity to have our students work with young people around program design, evaluation, so that they can be better public health leaders as they expand their professional growth and development. And overall, it is what the community needs. Again, being able to have an academic institution, being able to stand with community, and help build that legacy of work. You heard us talk a little earlier about Harlem Strong. Again, an initiative that's working with our community development corps in community boards 9, 10, and 11 in Upper Manhattan, working with our FQHCs and working with community members to learn about anxiety and depression, helping our providers fill those slots so that people can get that support, but also working with the Department of Health and using their resources so that while people can figure out what exactly they need and being able to get the kind of support that's important. Again, for us, it is critical that health literacy and health education is shared at every level of our community. So it's our honor and privilege to be able to be a part of these coalitions.
Excellent, excellent. And Kari, that's one of the things. So know the lane of environmental. The environmental piece, does the mental stuff also come into play there in what you do?
Oh, certainly. Yeah, we know that there's so many links between our mental health and environmental, sort of those underlying social determinants of health. And I mean, there's many different ways in which we were talking about trees earlier, and green space is being important for our mental health. And I think, one of the things that some people don't think about, and I think is important to remember, is that when we're experiencing emergencies or hazards and things like the heat event that's going on today, people who have severe mental health issues, also folks who may be using drugs or drinking excessively, these folks are at greater risk of heat illness. Because they may be, if they are exposed, they are more vulnerable to having heat illness of some kind. And so I think we need to remember that we have to be helping support all of those who may be more vulnerable, and recognizing that mental health is these are illnesses, these are things we need to help folks treat and find support for. I think another area that mental health and mental wellness and community wellness is important is making space, and just as Deborah has been talking about, to tell stories, to talk to one another about the ways in which we're experiencing our environments, our health, and also climate change and the issues that we're dealing with. And I wanted to just quickly shout out that we've been working to try to bring those stories out into the world, and we have a new feature on our environment and health data portal called Your Heat Story, where people have been so generous and shared with us their stories about experiencing heat and the things that they do to cope. And so there's a place where people can put in their own stories, and you can read about others and the ways that they're coping. So I think all of these pieces are so important, and again, recognizing that our health, be it physical or mental, is happening within the environments and with the people and the communities around us. And so we have to sort of build an infrastructure, both a physical one, buildings that are safe to live in, temperatures that we can, places where we can get cool, where we can breathe easy, et cetera, and also social infrastructure, community groups, educators, community health workers who are bringing this information to those around them.
Beautiful. And Carrie, question, in terms of, let's say, I don't know if it happened already, but there was a environmental forum that was held over at the Harlem State Office building. And I know one of the participants was my man, Dan Zarilli of the Climate Institute out of Columbia. You guys collaborate with them over at Columbia as well?
Oh, certainly. We've done a lot of collaboration with a lot of different folks at Columbia. I haven't worked with Dan recently, but he also used to be at the mayor's office and worked on climate issues there. Really a leader that we look to. And I want to shout out right now, we're working with a really amazing center at the Columbia run by Dr. Diana Hernandez, which is the Energy, Equity, Housing, and Health Center, and we are working right now with them on a really amazing project to talk to New Yorkers about their experiences of energy insecurity, because we are working really hard to influence ongoing policy related to people being able to afford their energy bills. And so and her team have done amazing work in this space. It's amazing what individuals have figured out to cope with the challenges of these high bills that we're all experiencing. But unfortunately, some of those coping things are not safe, right? Because one example today would be, oh, I'm not going to turn on my air conditioner because I'm concerned about the bill. Totally valid.
Wow.
But it's dangerous, right? And so what can we do? And if I could also make a shout out, so a lot of people aren't aware that the utility companies have something that's called an energy assistance program. And if you are enrolled in this program, you automatically have lower bills. And this is open to low-income New Yorkers. And some people who receive benefits, like, for example, SNAP or other social benefits, they're automatically enrolled. But not everybody is. And if you have Medicaid, you are eligible, but you are not automatically enrolled. So you should call your utility and make sure that you can have a lower bill. If you are, so call Con Ed and say, I have Medicaid, you need to put me in this program so that my bills are lower.
Beautiful, beautiful. Thank you for that. Roslyn, I heard both Deborah and, of course, Kari speaking about, of course, mental health in terms of Black Health Matters. Is that also one of the things that is addressed through your organization?
Absolutely. That is another pillar of what we do, is making sure that our audience is aware about what options are available to them for mental health, and also for self-care, which could be a softer way of saying you need to take care of yourself. I had just written down a note that, maybe Black folks should think about having 40 acres and a therapist if we ever get any form of
Good one. Nice. Oh my God. So NightWatchman, what you got over there, man? Talk to me.
Well, I wanted to go back to something that was talked earlier on, which is the issues of what's happening in Washington, and the attack on Medicaid and Medicare, the attack on affordable care, and just what should people be doing in terms of preparing for what's coming? Because over the next, I guess, year and a half to 2 years, we're going to see people losing their insurance. How do we cope? How do we deal with this? What strategic suggestions do you have for us?
I mean,
you want to take that first, Deborah? Oh, go ahead. I'm sorry, Roslyn?
No. I just wanted to add, and hospitals will be closing. Hospitals will be closing in areas that are taking on the most vulnerable of our populations. So there is a lot of turmoil getting ready to happen in terms of the health and well-being of all Americans. So we do need to think about being more proactive. So again, our platform is that we do travel around the country hosting sessions to help people feel better about the situation by putting them in front of healthcare providers who care, by sharing information, by doing screening programs, such as what will happen at the Black Health Matters Summit, which will be held on August 14th at the Riverside Church.
And speaking of Roslyn, so let's say you're traveling around the country, you're going into quote unquote red states. Do they understand what the heck is going on? What is happening?
I think Americans, and I can't speak for everyone, but we understand that there is something going on and that people are going to lose their benefits. But I think that, obviously lawmakers are totally out of touch with the needs of Americans. And healthcare should be a right. And again, many people just don't feel that way. They feel that it should only belong to a selective few. So again, it's our history of racism within this country that would even have us, make us, marginalized people not have access to care. So it's a vicious circle. So, we want people to be proactive. We want people to ask questions. Get in now. Get your screenings. Talk to your healthcare providers. Get that bench line, that baseline, because you don't, as you progress and age, you want to be able to compare what happened with your health today to what's going to happen in a year from now. And are you getting better? Are you staying the same? Or do you see issues that could be on the horizon? So become knowledgeable.
Absolutely. And of course, Deborah, do tell me, in terms of you heard what the initial conversation was or ask was. What are you doing with your constituency in terms of getting out the word and letting them know exactly what is happening globally?
So, we have been doing this battle cry for a long time, even before this bill sort of came out. And so you'll find on our social media, you'll find information through our Preparedness Response Institute, which is a collaboration between Emergency Management, Columbia University, the School of Public Health, and the Department of Health, to share this sort of information. Also, what I would say is, as an individual, as Roslyn raised, having your baseline information, I would also suggest, and what we talk about, is downloading your information so that you have a paper copy if you're possible, or being able to store the information to keep as an individual participating in your community boards and raising those concerns and talking with your elected officials about why access to care is important. It's coming out and supporting those kinds of conversations. It's organizations banding together to talk about the importance of why hospital systems and our federally qualified health centers are so critical. It's doing the things that Roslyn's talking about, meeting people where they're at and bringing the services to them, and having culturally competent, linguistically sensitive providers that can talk to our community members and break down the stigmas and discriminations that people feel about talking about health and well-being. It's all of those things. It's all of us showing up and raising our voices and helping those that don't feel like they have a voice, being able to share their stories. But now more than ever, it is really collaborating and using the resources that we have to ensure that our communities across not only New York City, but the state and the country stay healthy and well.
Gotcha. Carrie, you have to help us here now. Let's say we know.
Oh, I'm sorry.
Looks like we got stuck.
Okay. I was like, I think he got stuck.
All right. So just answer the question as best you can.
No problem. I mean, I don't think, I think Roslyn and Deborah really were so eloquent, and they're absolutely right. I think the things I would add, democracy is health, right? So it's so important that people are getting engaged, and that the ways that this is impacting individuals, every story that gets out there is a story that will help make a difference and will help reach hopefully the ears of those that are working on these issues. The health department has been very vocal. Our commissioner, Dr. Morse, has published op-eds to talk about how detrimental these cuts will be to the health of New Yorkers. And I also want to emphasize that New York City is a special place. We value every single New Yorker, new or long time. And there has been very clear messaging related to health and health care from the health department, from health and hospitals, our public hospital system, that we treat and support all New Yorkers. We are a sanctuary city, regardless of your documentation or otherwise, how new you are to our city. We value you, and you can find healthcare here. And these cuts are, they will harm so many systems, but we are in New York City dedicated to making sure that that we are taking care of all of the folks that live here, and we are being as vocal as we can, and we need to be joined by everybody in the community, exactly as Roslyn and Deborah have said, to speak out and make clear how important these systems are to supporting health, and how important it is that they are provided equitably, because one of the things that's so frightening about some of these policies is that we know that the burden will fall upon those who have already carried disproportionate burden because of inequities and structural racism and other issues that have disproportionately hurt people of color in our communities, people with lower incomes. And we need to make sure that we are fighting against anything that would increase that burden.
Okay, great. I think Curtis is joining us again.
He's back.
Barely. Can you guys can hear me? Of course, yes.
Yes.
Would you believe this is the new reality? Would you believe that my computer ran out of power?
Night Watchman, I just want to drop in also to say a quick thank you to all the frontline workers and all of the nurses, PAs, doctors, the folks who all show up to support, because, as services diminish and insurance diminishes, they're still going to be there fighting the good fight. And just wanted to take a moment to acknowledge all of those that keep those systems operating.
Oh yeah, that is so important and so key. The health workers do such a tremendous job, and people don't recognize, not only how hard they work, how dedicated they are. I was unfortunately last month I lost a brother-in-law to cancer, but I was able to spend a week with him before he passed, basically in his hospital room, and the dedication that you can see from people in our health services community is just nothing short of inspiring. And I think people, sometimes we forget how blessed we are to have people who are so committed to our health and not take them for granted. So thank you for that, Deborah.
Yeah,
so
our condolences and all. And so just wanted to say that. So thank you.
Yeah, yes. We're at that age and stage where, it's where you lose parents, then we lose people younger than us, and that's really, it just hits you a certain way. So we're at what we call our lightning round. We're going to give everybody a chance to have some last remarks. So let's start with you, Roslyn. You have some things you wanted to share with us?
Yes. Again, please come out to the Black Health Matters Summit. It embodies everything that we discussed today. It'll be held on August 14th at the Riverside Church. We're going to screen for A1C, glucose, breast self-exams. We'll have PSAs for prostate, hypertension, HIV, hepatitis. We also are going to have, through Choose Healthy Life, a metabolic blood screening that will look at you for 28 different conditions. It'll test your kidney function, your vitamin D levels, you name it. So this is a test that would probably cost, $1,000 plus, with the full battery of what we're offering. And we're giving that for everyone for free. In addition to that, we have breakfast, free lunch, and incredible educational sessions that will uplift you and empower you. So please come out on August 14th from 8 to 5.
Great. Carrie, some last words.
Yeah, I would just say today it is hot out there, and we know that climate is more real. Climate change is more real every day, and the impacts on our planet, they are impacting our health. I want everybody to stay cool. We know that more than 500 New Yorkers die every summer from the heat, and we want to bring that number down. So please seek out a cool space. If you don't have air conditioning at home, then find one of the many cooling centers that are throughout the city or other cool options. Go to a friend, a family. Even just 2 hours or more in a cool space will reduce your risk of heat illness. And if you're outside, water, rest, shade. Please make sure to be staying safe. And we really want to make sure that folks are not succumbing to this incredible heat that we're experiencing, which will be continuing. Get a little cooler tomorrow, and then it's going to continue on Sunday and into the week next week. So please stay cool and check on your friends and neighbors. We are amazing at that as New Yorkers. We are a community, so please make sure folks have a plan to stay safe in the heat.
Okay, Deborah, you get the last word.
Ditto to all of that. Please, as you're seeing community health fairs in your community, take advantage of them. Those that are out there doing that work, please stay hydrated. Please take those breaks. But most of all, thank you to all of you for all the great work that you do in helping to share health information in a way that's accessible. So thank you to all the good work.
Wow, that sounds great. Yes. So Night Watchman, I mean, do you think everyone will be invited back to the cookout or what?
Absolutely. So, Curtis, do you want to take us home?
Well, that's not my job. I don't know that one. Night Watchman, I'm on my knees. Thank you also for rescuing me from the abyss. So thank you very much, Night Watchman. Okay, so you take us home, buddy.
Okay.
Yeah, I got you.
Yeah, you listen to Soul Lounge Prime Time on WHCR 90.3 FM, the voice of Harlem. Also live streaming on YouTube and Facebook. You can always find us on Monday evening at 5 o'clock on the radio and 8 o'clock when we live stream. They changed. They changed. Wait a second. They changed the times on us. It's 6 o'clock on the radio.
6 o'clock
and 8 o'clock
on YouTube.
We're on sometime on Monday. I don't know what time we're on.
But this has been a great show, buddy. Great show.
Absolutely. Yes. So thank you all for joining us. We appreciate your efforts and your experience. And everybody, stay warm, stay cool, rather, and stay healthy.
Who are you? Anyway.